Hello, my name is Tajira Locke and today is February 14, 2019. I'm going to be doing a video on trach cleaning and suctioning. So I'm going to start off by going into the patient's room. I'm going to confirm their identification. So I'm going to do name and date of birth, and then I'll check to make sure that everything matches. I'll go ahead and introduce myself to the patient as well and let her know what I'm going to be doing and talk to her about the procedure. Also go ahead and raise the bed to a movable working height, and also make sure to provide privacy. Before continuing with anything, I would also make sure to assess the patient to make sure that their respiration, I'll check their respiration rate, rhythm, and depth. I'll also check their lung sounds as well as their heart rate. I'll also go ahead and check the trach air to make sure if there's any secretions and note the consistency as well. I'll also go ahead and turn on my suctioning between 80 and 120, and then I'll go ahead and hyperoxygenate the patient. I'll also want to establish a mean of communication when I'm suctioning, so that may be raising her hand if there's any trouble, just so I'll have an idea if anything is going wrong. I'll go ahead and provide hand hygiene, and then I'll go ahead and open it. While I open that up, I'm just going to go ahead and open up my normal sterile water. Once that's open, I'll go ahead and take my gloves out. Go ahead, put my gloves on. Trying to make sure that it's not touching anything. Once that's on, I could go ahead and readjust my gloves because it will be sterile and sterile. Then I'll go ahead and get rid of this. Try my best not to drop my hand below my waist. That would have been in the trash. Then I'll go ahead and take out my suction. I'm gonna try my best to keep this drop in the trash. I'm also gonna make sure to keep this as in my dominant hand. While we're doing that, we had already hyperoxygenated the patient, so I'm gonna go ahead and take this off. I'm gonna go ahead and connect this. So now this hand is no longer sterile. I'm gonna connect it. And then I'm also gonna check to make sure that the suction works. And this is between 80 and 120, as I said before. Once that's done, I'm gonna go ahead and insert it in. I'm making sure not to suction while I'm going in. So I'm gonna go in. Normally the patient will start choking or maybe until I reach resistance. Then I'll go ahead and do continuous suction on the way out. Intermittent suction, not continuous, intermittent. Once that's done, I could go ahead and do it again if the patient still seems like she has a lot of secretions in. If not, then I'll go ahead and hold this up. I'll disconnect my suction. Then I'll also go ahead and take the old dressing off. Once that's off, I'll go ahead and put everything in the gloves, and I'll throw that out. I'll make sure to provide hand hygiene again. And then I'm just gonna go ahead and just clean up my area. Just kind of have this right here. So I'll provide hand hygiene. I'll go ahead and open my kit up because now I'm going to get to cleaning. Open my kit up, away. Then I'll go ahead and take out my drape. This is just to expand my sterile field. Then I'm gonna go with shiny side down. Just on the outer edges. I'm not trying to get inside of it. Then now I'm gonna go ahead and take my gloves out. Just kind of move that away a little. And I'll go ahead and put my gloves on. It's a little bit messed up, but we'll try to correct that once I get it on. Okay, now making sure not to touch anything. Now I could go ahead and correct this. Now that that's corrected, just kind of move that over a little. I'm making sure to keep my hands above my waist. Then I'll go ahead and arrange my equipments. I have my gauze. I'm just going to leave it right here in one part of the compartment. I'm going to go ahead and pour normal saline. Then I'm going to pour some in another compartment and then the rest in another. I'll be done with that. I can throw that out. Then I'm going to do half hydrogen peroxide. And now we can go ahead and throw that out. Once that's all situated, I'll go ahead. After doing that, I'll then go ahead and take the inner cannula out, but I'm making sure that I'm using my non-dominant hand because once I do that, it's now contaminated. I'm going to use my non-dominant hand to take this out. Then I'll go ahead and put that in. Then I'll use my dominant hand to take the brush up and trying my best to get all the way in. Once that's done, I'll then go ahead and put that in the normal saline. I'll go ahead and throw that out. I'll then use my dominant hand to take that out of the normal saline. Then I'll go ahead and reinsert it. There goes the click. After doing that, I'll also go ahead, kind of, then I'll go ahead and wipe the area. Just kind of wipe around. We could probably do this for a second time, just to make sure that until that everything is cleaned up. Then, after everything is cleaned up, I'm gonna go ahead and change with assistance from somebody else. I'm gonna go ahead. Okay. Just kind of go ahead. And I'll just kind of push this through. And then take that in. Then I'll do the same thing over here. And push that through as well. And then take, and then I could go ahead and remove the old one. After that is done, I would also go ahead and change my gloves again, just to make sure that everything is sterile. And then I'll go ahead and attach, go ahead and put that on. Try my best to just kind of slide this under. Right now it's just trying to do your best to not let anything touch it. Making sure you're trying to remain as sterile as possible, even though this may be hard. And then we're gonna go up under. Once that's done, we'll go ahead and throw this out. I'll make sure to document how the patient took the procedure. Make sure to document if there was any drainage or anything. I'll also make sure to put the oxygen back on, the patient's oxygen back on. I'll also want to know if the patient, how is the patient doing, if I could get the patient anything. And I'll make sure to lower back the bed and put the call light in reach, and also make sure to clean up my equipment as well. And that would be it.